Okay, good morning, everyone. This is Phil Pugh here at Memorial Hospital in Belleville. I hope everyone is having a great day on this Wednesday. We're going to go ahead and get started. Folks will continue um, to arrive, so you'll hear a bunch of beeps, and I apologize because I didn't have this set to admit everyone, so I have to admit folks as they arrive. And there's one more. So you'll hear that. So as a reminder, please keep your phone on mute as we go through the slides, unless you need to speak, and then unmute, please. Greatly appreciated. And please, 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 whatever you do, don't hit the hold button if you're at work or listening on the phone. I do see a lot of folks we got logged in via Teams, and that's great. So you probably can see the slides and don't have any issues. And I won't hear any Kenny G from you should you have to press hold. So let's go ahead and do a quick roll call for the folks here. We'll start with the hospitals. We'll start with Anderson Hospitals.
I'm here, Phil. This is Eric.
Gotcha. Anyone from Alton Memorial?
Ashley Spear.
Gotcha. Anyone from Boyd on currently? Carlinville Area Hospital? Community Memorial Staunton? I know Sue said that she would be trying to join. This is one of her scheduled PTO days, but she would try to join. How about Fayette? Anyone from Fayette?
This is Tina, and I'm on.
Gotcha, Tina. Great. Gateway. Anyone from Gateway? I think I see Danielle on. I don't see Rick. How about HSHS Holy Family? Anyone from HS Holy Family? Anyone from HSHS St. E's? How about Breeze or Highland? How about anyone from Jersey Community Hospital? As far as Memorial, you have myself and Lee here covering Belleville and East. Leanne is currently working diligently with the team out at one of our sample collection sites here in Swansea. How about Memorial Hospital Chester? I think we got Georgia on. Georgia, you there?
Yeah, I'm here.
Gotcha. How about OSF St. Anthony's? Redbud Regional Hospital? Sparta? And Touche.
I'm here, Eric.
Gotcha, Eric. Thank you. How about our health departments? Bond County, Calhoun County, Clinton County, Eastside Health District, Fayette, Greene, Jersey, Macoupin, Madison, Monroe, Randolph, and/or St. Clair County.
Hey, Phil, it's Lee.
Hey.
Hey, there's a lot of texts coming in. The numbers that were in the thing for the ID and that are not working. So there's a lot of folks who are unable to gain access.
Yeah, in the email and appointment that went out, it didn't let me in. I didn't get the call-in number until I actually entered through the Zoom. I didn't get the correct one.
Let's double check it. Stand by one sec. And I know we got some other folks jumping on. Let's stand by quickly. Stand by. I've looked at all three meeting, the one that's on Member Planet, the one I sent out in the email, and one that's online. I believe they're still looking at the old one that they didn't delete, and that's an old one. So I'm not sure exactly which one they are accessing currently. But we do get we still have folks joining, so we'll give them another. Let's give them another minute or so, and then we'll press on.
I think the one in your Zoom link where I was able to get on the computer with, the number was incorrect there too. Until it opened in Zoom or Microsoft Teams or whatever it was the correct number there.
Yep, I'm looking at it now, and I'm not sure how or why these are switched. So I'm going to send this out. So yeah, that conference ID should be 583-790-701. I am not sure how that's not the same on the one online, because it's the one that we built it from. So I'm going to resend that out right now. Let's see. I just sent that out, and I'm going to readjust what is on the Member Planet site as well. So let's give those folks a minute to dial in. Sorry for the confusion there. I'm going to fix that now on our site. I wish I could push hold so everybody could hear some Kenny G while we wait, but probably can't. Stand by.
To listen to your message, press 2. To erase and re-record, press 3. To continue recording where you left off, press 4. Sorry you're having trouble. Your message has been sent. Goodbye.
Hello. Hello.
Not sure who that was on their call, but all right. It looks like we got a few more folks that have made it in.
Mom.
Perfect. Okay.
Hello. What the hell?
Not sure who that is, but
Mom.
stand by.
I've said hello 12 fucking times. What the hell? Hello. Whoever that is, we can hear you and we can hear you cursing.
Because of a bad connection. Your call has been forwarded to an automatic voice message system. 314-660-7068 is not available.
All right. It looks like we got a few more folks in. Got about another 8 or 9 folks that have made it. And again, sorry for the confusion.
You there?
Again, as a reminder, please make sure that your phone is on mute. That we do have a lot of background conversations going on currently. All right. With that said, we're going to go ahead and continue on just with the roll call.
Can I help you?
We made it through most of the hospitals, and as
This is her husband, Scott. Can I help you?
Hey Scott, you're not on mute.
How can I help you? Hello?
This is Mila with Eastside.
Hello?
We got you, Mila.
Yeah, how can I help you?
Scott.
This is Derek with Macoupin County.
We'll
How
get
can I
you
help
there. Stand by 1 sec. We'll see if we can get. See if I can find if I can mute an individual.
How can I help you? Yeah, this is her husband. How can I help you?
Okay, I have muted said participant. All right, now we'll move on to the health departments. I apologize for the confusion, team. We'll conquer this and move forward. We'll start with Bond County. Terry, you there? How about Calhoun County? Clinton County?
I'm here, Phil.
Gotcha. Eastside Health District?
Mila's
I got you,
on.
Mila. I got you. I'm sorry. Fayette?
Kinder Craig here for Fayette.
Greene County? Jersey?
Jersey here.
Macoupin County?
Macoupin's here.
Madison County?
She's trying to get on. She'll be on in just a second.
Sure, no problem. Monroe County?
Vicki with Monroe here.
Gotcha, Vicki. Randolph County?
Debbie with Randolph County is here.
And St. Clair. Thank you, Debbie. Okay, I'm sure we'll have a few other folks join. I do know we got, as far as our community partners, we do have Greg Atterbury, our regional EMSC. How about Beth Busman? Are you on, Beth?
Yes, Phil, I'm here.
Gotcha, Beth. Thank you. Any of our BJC counterparts?
Hi, this is Katie Tamke with BJH.
Hi, Katie. Thank you for joining. Any of our EMA counterparts? How about MedStar Ambulance? I see we got John Nowak on. What about SLU? Anyone from Scott Air Force Base? Or STARS?
This is Dale Chambers.
Hey, gotcha, Dale. Thank you. Now, how exciting
Gary
was
from St.
that?
Anthony's.
Hey, gotcha, Gary. Appreciate it. How exciting is that? I mean, we don't have a coalition meeting. We've had once a week meetings for COVID-19 and more meetings prior to that without a hitch. We go back to try to do a regular coalition meeting and we got gremlins or ghosts in the shell somewhere. So thank you guys for your patience. We're going to go ahead and get started. I'm recording this and it will be uploaded to the site after the meeting is done. So should you forget about it, and you need to run it back later, just skip ahead about 17 minutes. No, I'm going to trim it so you don't have to go through all of that. So again, thank you guys for taking the time out of your day to join us. We're going to go ahead and get started with our coalition meeting. This is June 3rd, 2020. And it's been a long time, it seems like. This is pretty much our agenda. This is always our standing agenda. We'll go through IDPH, give Greg an opportunity to provide any updates from his perspective. We'll reach over to STARS and allow the STARS folks to discuss a few things. Move over to the health departments, give Beth an opportunity, and we'll talk a little bit about REMERT from Mike Gilbert and/or Lee. And I don't know if we got Dana on or if Sue had an opportunity to join. Then we'll move on to mental health, then our old and new business, and then we'll open the floor up. So we'll start off first with Greg from IDPH.
Wow, me right off the bat. I don't really have a whole lot since, we've been meeting for the most part on a regular basis with everybody. I will let everybody know that there was additional IDPH guidance sent out about elective surgeries today. So make sure that gets in the hands of the appropriate people. They will be using EM resource data. From what I understand, it will be downloaded, I believe, Wednesday night into Thursday. It should have it on the memo, but there are metrics that will need to be met to do surgeries over the past 7 days metrics. So just make sure that it got into the hands of the folks who need to have that. Also, another reminder on EM resource, I let the EMS advisory meeting know this, but right now, no hospital should be going on bypass unless there is an internal disaster, meaning something, to do with water, electricity, fire, that kind of thing. You should not be going on bypass for staffing or CT issues, and that because right now the state has sent out a directive that no hospital in the state should be going on bypass during the COVID-19. If you do have a CT go down, so you don't want those stroke patients, you should be going into EM resource. You go to your status, you change it from open to open, but you put a comment in there that your CT is down. And that's really how that should be handled even outside of COVID. If you go on bypass, that means you're on bypass for everybody. And most hospitals don't mean that when their CT is down. So I share that aspect. Also, we talked in the EMS that with some of the peaceful demonstrations that have occurred, we've had a bridge blockage already once in our region. So know when you're looking at transferring someone from your ED or your hospital to a hospital in St. Louis, you're kind of keeping an eye on what is actually going on, and know that transports, if there is any interstate blockages or that transports could be delayed. And from an IDPH standpoint, I'll let Phil talk about all the grant stuff, and that's all I have, unless anyone has questions.
Hey, Greg, this is Kelly from Jerseyville. Is there a website or something that we can keep an eye on anything as far as roads being blocked over in St. Louis?
We talked about that on the trauma and the EMS, and it's really going to be kind of word of mouth. The SMOC is doing some things and trying to notify, so all the system coordinators have to be notified about that. And if you're looking to get, because you're EMS Region 3, you might want to send your contact to Mike Gilbert, and he might be able to keep me in the loop.
Hey, Greg, it's Mike Gilbert. What I will do is if I get information, I'll give it to Phil and have Phil send it out to the whole region.
Okay, that'll work. I appreciate it.
Hey, guys, it is John Nowak. I finally figured out how to get unmuted. The SMOC from St. Louis was going to try to use EM resource without driving everybody nuts with any info that they could get. So that's going to happen also.
Correct. And John, thanks for bringing that up. And about 6 months ago, we finally worked out the kinks to allow the left side of the river, the folks over there in St. Louis, to be able to send MCI alerts, high priority announcements, et cetera, through EM Resource to our region hospitals. Hence the reason yesterday when I sent out the notification to everyone that there would be a request at 2100 last night, they were able to send that directly. So this is a good thing for us working, back and forth across the river, so they can send out those announcements as they receive them. And I do know they don't want to have information overload, but it's highly important that you guys, especially the resource hospitals, have your EM Resource on and open so you can receive those alerts and change. And I highly recommend you changing your alert preferences within your account to ensure that it's sending you maybe a text message alert or an email as well for the high priority announcements, MCI alerts, et cetera. If you don't do that, then you'll kind of find yourself in the dark. It's kind of, when handling multiple things, when you're in a multi-agency coordination center like the SMOC or here at the RHCC, you really don't have the time to run down a phone tree and dial individual folks. So ensuring that your EM Resource notification preferences are up to date are really, really key. And if you don't have access to EM Resource, especially if you're a hospital, don't have access to EM Resource, or you're having issues with it, please contact myself, Lee, Greg, and we'll make sure that we get you squared away. But that's where the information is being housed currently. Not just bed numbers, not just that, but those are where those high priority announcements are going. So thanks everybody for working that. Do we have any other questions for Greg or the process of how we're getting out those announcements for road closures?
Hey, Phil, do we have Jersey hooked into that cross river thing, since they are, kind of an island to themselves, being in Region 3?
It's kind of weird because I can't, and this is the one flaw that we have currently, is that I can do a multi-region event, but so for instance, I used to be able to do a multi-region event for 3, 4, and 5 region. But now that I have access to the St. Louis instance, I can only do one between St. Louis and Region 4. So I sent something to Dan Lee about it, because I don't know if that's the same if they have the same issue on the other side of the river. And from what I understand, last night I think they only sent it to the STARS region hospitals. I don't know if they sent it, all the way up to Jersey. I can't remember last night. But that might be an issue. Dale, I know you're on the line. Do you know if you guys have any issues reaching folks in Jersey County?
I'm not aware, but that has been beyond my typical technical expertise. So I am making a note of this, and I will check on that today and see what I can find out for you. That might be a while before I have an answer for you.
Well, we appreciate you checking in on it, and I'll follow up with Dan just on what I've noticed from our side. But I can reach all the St. Louis hospitals, no problem. I just can't. I would have to do a separate message if I went St. Louis, Region 4, and then for Region 3, I would have to do a separate message. Okay, so we'll go ahead and move forward. We'll give STARS folks an opportunity to discuss whatever they got going.
So thank you all for that feedback. Taking some notes there so that we can better support the entire region with information sharing. Yeah, there were some hiccups in the beginning, and we're working through those and learning a little bit more each and every day. So thank you all for your patience on that. We're looking to do better. So St. Louis County Emergency Operations Center has been stood up during the recent civil unrest events. And last night had a lot more partners in the room than had been in the previous couple of nights, primarily focusing on intelligence gathering and sharing in a very rapid method. And I think that supported some operations in the field pretty quickly last night. Last night was a quieter night, thankfully. We do know of a variety of known and planned protests, but of course it's the unplanned ones that tend to be more of the problems. So just keep, as Phil said earlier, please everybody keep an eye on the news. If you have anybody that does watches social media accounts, please watch those, particularly anybody's live feeds. The one thing about this civil unrest that is a little different than that in the past is information is harder to get. There are a variety of dark web kind of apps out there that are being used, as well as direct conversations that are limiting the use of social media that is accessible to intelligence. So with that, there's not quite as much information leading into things as there has been in the past. So it's not that somebody is keeping information from you. It literally is that they can't find it, or it is so rapid that by the time they have it, it changes. So just for everybody's awareness. Other than that, our typical activities that include everybody, throughout the region, the complex coordinated terrorist attack items have been delayed due to COVID, and we had intended to get those restarted here in the next few weeks. Not sure if that's going to happen based on the current situation and the ongoing activities, just like y'all with other ASPR related programming. So we're moving forward in that direction as well. Other than that, I don't have a whole lot more to address. Any questions?
Thank you, Dale. Any questions for Dale? No? Okay. Thank you again, and we'll go ahead and move on. Mike, any updates from REMERT?
So a lot of our planned training events with our partners have been canceled, and so far the Scott Air Show's been canceled, the marathon's been canceled, but we have some of our guys that have been staying quite busy helping the RHCC out with our deployment of PPE that we've been doing, and also with moving all the equipment to the alternate care center or alternate care site that we were looking at prepping to stand up. They have been helping Lee move a lot of stuff around. So they've been very active during the COVID, doing some training just in case we had to assist the region. So and then I think our organization is going to try to get back to training next week or next month. So we'll be back at our training starting next month. So
thanks, Mike. And during that time frame, so through the pandemic, I'll tell you, REMERT has been a great resource. There are tons of things that you guys probably aren't briefed on, and maybe we just need to do it, add it in as a routine. But our REMERT folks are constantly on, whether it's urban search and rescue, support for fire department operations. We had that huge fire out. Was that in Granite City, Mike? I'm not sure, but we had that huge
Sojay.
In the Sojay fire, very large warehouse fire. Where you got to call in tons of engines to work that, and they provide rehab for those folks. And command and control assistance, and not to mention some of I like to double back on the things that Mike mentioned with regard to us establishing alternate care site operations. So we took we kind of leaned forward earlier, and I'm just saying, when I say we, I'm talking about Memorial Hospital specifically. We leaned forward early, and when we basically went on the initial lockdown, we reached out to our partners out at Faith Families Church in Shiloh, who is a part of, our internal planning and as a location for an alternate care site. And Ted, Eric, Mike, Lee, Leanne, others, we really worked hard to set up an alternate care site at that facility. And that takes a lot of planning and takes a lot of manpower to move stuff around. And those guys did a great job. And there's tons of other things that they're doing. So I'll always make a plug for Remert and saying that they do more than you see. And a lot of that work is rewarding work. Some of it's fun, some of it's just tiring, and some of it's just plain out boring. I'll be honest, sometimes they may feel like they're just, holding a position. But without them, in certain instances, a lot of these events don't go on, and some of these responses just don't happen without them. So thanks to them. And if you're thinking about events in the future in which you may need support, Remert is a great resource that we have here. If you ever need to or want to schedule anyone from, or the Remert team to support an event, just reach out to myself, Mike Gilbert, or Lee, and we'll point you in the right direction. And we're always looking for volunteers. So thanks, guys. All right, we'll move forward. I don't know if Sue or Dana jumped on. Sue, have you jumped on? Nope. Okay. And I don't think Dana's on. But as far as the mental health team, I wanted to see if I got any feedback from folks. Has anyone had a staff member or anyone use any of the mental health services that were provided about a little over a month ago? I would say 5 weeks ago. We pushed out information on it was probably about 4 weeks ago, sorry, information with our mental health providers and crisis response lines. Has anyone taken advantage of that? I know of 2 folks here at Memorial Hospital that took advantage of it and have actually set up counseling sessions from that. So seeing if anybody else had any feedback on the use of those lines.
Hey, Phil, this is Eric. I would suggest that we probably had several employees that took advantage of it, naturally due to the nature. I did not specifically follow up with them and ask them if they went and did that. But we pushed out that information when you all shared it and touted it, certainly within our facility. And I, within days, got immediate response just saying, yes, if you need this service, just call them and facilitate and let me know if we can do anything further. And I didn't hear back. So I think the answer from our area is, yeah, I would suggest multiple people used it, but I don't know for a fact because it's their business, not mine.
And Phil, that's the same thing from John Nowak. This is exactly the same thing. I know there was multiple employees that had asked, and then when we provided the information, I believe there was contact made. But yes, wonderful tool.
Well, I'm hopeful that folks continue to use that because this has been a stressful response on everyone, and those who are nearest to the bedside, and even those that are kind of detached from the bedside or not in the provider lane, the support that's required to support them in doing their job. Your materials management folks, your supply chain folks, your transporters, all of those folks, they are hustling. I mean, I had someone basically tell me about their staff breaking down after we had a cluster. When I say cluster, that means a group of folks who ended up being COVID positive that were staff, and this person just broke down because they were so worried that they have 3 kids, single parent, father, and was looking at what happens if I'm going to be furloughed because of this exposure, or what do I do here? And that stress, is on someone who's, not on, it's not always someone dying in the hands of a provider that can push someone over the edge. They need an outlet. So this has been a stress on everyone. And the recent, I'd be remiss if I didn't say, the recent protests that we're seeing, I'm sure are only exasperated by the fact that we're going through a pandemic response. I had a friend of mine text me the other day and say, "Hey, do you remember that COVID-19? Wow, that was a crazy time." Saying it in jest, but the fact that it is almost being overwhelmed by the other stressors that we have socially in the country today. So I'm making a plug again, and when I send out the link to this meeting, I will also send out copies of the brochures, and I'm just encouraging everyone, when you see an individual and they look like they're stressed, lend an ear and help provide them a resource. Don't just be an ear that they can bend and they can talk to, which is great. Provide them a resource. Be a resource, because it's not always, you may say it's not, I don't have the capability or the ability to do something. A lot of times it's not your ability, but your availability and how you make yourself open and the resources that you have at your disposal open to others. Okay. This morning, I just got news that a good coworker that's here, when I say coworker, not in my office, but here on this side, is resigning effective Friday. And I don't know what we're going to do without this person in the organization. But this person is extremely stressed. And I hold a sentiment of guilt, because I reached out this morning, and the note that I sent this individual this morning was, "Hey, you're really appreciated. I don't know what we do without you. We're going down this long tunnel, but there's light at the end of it, and I need you to help me get to the end of that." That was the email I sent at 8 this morning. The response I got back, "That was sweet, but I resigned effective Friday. I just can't take it. Stressed out." So it's real. I'm asking you guys to hold on and use the resources that we have available. So I'll jump off my soapbox there. But I'd like to thank Dana and Sue for championing this team out there and keeping them together. We need it. All right, we'll move on to old business. Things that it probably feels really old. March the 4th was our last face-to-face meeting, and it seems like that was eons ago, but it really wasn't that long ago. So the first thing I'll talk about is grant status. And we'll talk specifically the current grant status that we're on now. We're still in BP1. We have received a no-cost extension, and we're working through that. So IDPH provided us a briefing not too long ago about how that's kind of working. We initially said that we're going to get some monies. Then after that, immediately after we sent back the information to IDPH, it's like, if you didn't submit it, don't submit, because we're going to get some more money. So the initial amendment to that was about $70K. If you're looking at the slides, there was an additional $70,000. And then after that, there was another additional $170K $1,000 on top of that. Didn't know that was coming. So that pushes us upwards to $800,000 total for that total of that award. So we're kind of in the middle now, where we're going to have to readjust budget items and execute on these items. So some of the questions that I've received, not just with regard to the no cost extension or the additional funds, were COVID has happened. We're just delayed. We didn't get our, the grant was slow to come out, as it has been traditionally. And traditionally, or this year, I think we got word that the grant was going to be approved. The work plan was approved back in November timeframe. And then right around the middle of January, we had an executed grant. And then after that, that's when we worked out with partners, yourselves, to create subawards. As you guys know the process, you guys submitted your project requests, they were approved, and you did a subaward. And it takes us about 30 30 to 45 days to get the stuff out to you guys, get the training, get all the documentation back, get it reviewed, submit it back to IDPH, and have IDPH review it all, and then push forward. So that process takes time. Now, to be clear, this past year we did get approval for going forward that once our work plan is approved, we can begin spending money. The only problem with that is that doesn't necessarily include the subawards. We still have to ensure that those subawards are executed before you, as the buyer, as the person who's going to execute the subawardee, we have to have that executed grant before we can create a subaward and have you start spending. So, for instance, let's say this year, because I just got off a phone call before this one, that we go forward and we just reviewed the requirements for this year's grant coming up, going from in BP2, going from 2020 to 2021, 1 July to 30 June. When we go through and put in we get an approved grant through eGrams, and Greg reviews it and everybody reviews it, but it's not fully executed, but we have basic approval on the work plan. We, Protestant Memorial Hospital, can begin executing on those funds. We can begin executing on those funds. However, we cannot begin executing on the additional funds for the subawards. And I don't know if we're going to find a way around that. So what I'm going to ask you guys is that be cognizant of that process. So if you were to, for instance, Eric has done a great job of, I think when we first started maybe 2 years ago, wanting to put on TNCC courses. So we had a problem with executing on those TNCC courses because we were waiting for subawards and grants to be done, to be executed. That delayed everything. So we had basically a 4 or 5 month window to do what he wanted to do over the course of a year. So if you have things like that, we, Memorial Hospital, will gladly take over, and you may submit that as a project request. We're not going to deny that project request, but we will execute on it because it's training. It's not something that, basically we just have to pay a bill. You can still coordinate it as a subawardee or the person that wants to host the training or wants to manage the training, but we'll pay for it. That gives us the ability to go forward and execute on things that we need to execute on more rapidly. Now, let's say Eric wanted a $25,000 refrigerator to house SNS supplies. That's something that we would want Eric and the folks over at Anderson to have an executed subaward for, and we want them because they would own that piece of equipment and be responsible for that piece of equipment. It's a capital purchase. It's a piece of equipment. We would want that. So that would be something that would be delayed, but that training, we can execute on that training and we would not put that in your subaward, okay? So as of right now, we are going to be reallocating funds on the BP1. We're going to move forward on our BP2 grant, which will be delayed, obviously because of COVID-19. But I want you to start thinking forward and say, all right, if there's something that Memorial Hospital can execute on for us, and more often than not, that's going to be an educational opportunity, not an equipment purchase, unless it's something that we're doing like what we did with the phones for the FirstNet phones that everyone received. That's a project that we ran. We're maintaining all that. We didn't ask you to do that below you. But if you're going to have a big equipment purchase, that's something that we're going to expect you guys to purchase. If you're going to do a big pharmaceutical purchase, that's something we expect you as the subawardee to purchase, not us buy and then reallocate. So I know I said a ton of things. I'm sure you've got questions on, so what do I do now with regard to spending? Over the past 2 weeks, I've had questions come back to me that I've forwarded over to BJC of what do we do because we were not able to spend. The IDPH Summit was canceled. I had $1,500 set aside for that. Can I reallocate that and spend it on something in supplies, for instance. Yes, you can do those things. Will you receive a no-cost extension? We are discussing that right now. And I'd like to get your feedback on what you think about how you're able to execute on the current monies that you have and what you would like to do going forward. So I'm gonna shut up and I'm gonna give you guys an opportunity to kind of ask questions or make points so we can kind of figure out a way forward. The floor is yours, guys. So don't everybody shout out at once.
Phil, this is Eric. First of all, about that $25,000 refrigerator I ordered, I hope that keeps my beer cold.
Okay.
Secondly, as far as the money goes, and speaking for myself, and I would encourage others to look at it this way too. The one thing I told you about in full transparency that I was most concerned about when it came to being able to go forward with the approval of using it eventually is the designated infection control officer class that we were going to host, and of course open it up to the region. And that was, of course, specific to EMS agencies and pre-hospitals agencies so that they could have truly trained designated infection control officers. STARS put these on years ago. I feel that they were less than well attended. I think we would do a better job regionally of pushing it out and getting the word out there to the point where I already still have people contacting me about, hey, when are these classes going to occur? Everything else that I applied for, speaking personally, was, like you said, the IDPH, other conference type of emergency preparedness type opportunities. And I see no reason why I would hold that money here and say, well, I would like to do it for supplies. What I would suggest that I and others do is consider tossing that back into the regional pot, and we can gain from it regionally rather than individually.
Okay, Eric, thank you. Thank you for that feedback. Any others feedback on what Eric either said or what I said, or how do you perceive that we, try to execute on some of these funds going forward?
Phil, this is Tina.
Yes,
And
ma'am.
I would say that I like what Eric did say. I know we did not apply for any funds currently. And I think with COVID and with RHCC, with the supplies you received, and then maybe depending on how much other supplies you were going to receive, that Anderson might be the holder of some of that. I think looking at what we just went through, I like the idea of putting things back in the pot. And then you have a better grasp on what we need, especially with the fall and some other things in next year coming and not knowing what's going to happen.
Thank you, Tina. John, how about you? I know you guys don't normally submit a like a specific request for EMS, but what are your thoughts? I mean, given the current state of affairs today, how would you like to see some of that money executed from an EMS side? John, if you're talking, you are muted. I'll give you another second or so to unmute.
Hey, Phil, I would have some comments there, sir. I'm trying to multitask here.
I know it.
I'm actually getting a CT done, so I'm going to be unavailable for about 15 minutes here, they tell me, and then I'll be back on. But I love Eric and hearing Tina say that, because then it truly does. That money helps us as a region. And as we all know, there were multiple things that were going on that with all the great planning that we have done together, we kind of didn't think about a few things. So there are things out there. Training is huge. Infection control training officers is huge. But anyway, guys, I'm sorry. Like I said, I'm trying to multitask. I will be back hopefully within about 15 minutes. And Phil, I will send you an email.
Yes, sir. Thank you very much. Anyone else with perspective?
Hey, Phil, it's Mike.
Hey.
I'm going to jump on with what Eric said. I think with the pandemic, it has really brought to light the need for the designated infectious control officer, because when all the resource hospitals came out and said, hey, we need your designated they're like, well, who's it supposed to be? What are they supposed to be doing? Not a lot of people have grasp on it. We've talked here in the system in our office that we were also trying to fund to get all of our guys through that this year. So I think looking at what some of this pandemic has brought up and maybe throwing some money at some fixes to make the next time a little smoother would go a long way.
Thanks, Mike. Hopefully there won't be a next time, but there will be. You're right. Anyone else? I don't want anybody from the health department side. What are your thoughts on the funds? And I know we all have different kind of grant funds and different responsibilities, but from a provider side, what would you like to see us do going forward? And a lot of health departments did apply for grants. A lot of things were kind of medical-ish, EOC related for the local health departments and participate in with some EMAs. What are your thoughts? I know Tiffany's wheels are spinning. She wants to say something.
No, I'm good.
Okay. All right. Okay. So thank you for that feedback. If you're still chewing on it and thinking about how you'd like to see things moving forward, please don't be bashful, but let us know. This is not Memorial's. All of this is not Memorial's money. Out of that, at the RHCC level, we're supposed to set aside approximately $250K for RHCC. And I can tell you right now that we don't spend $250K for Memorial each year. And that goes even with salaries. We've broken this down before in previous coalition meetings. We probably spend $100,000 across salaries, and that's for 4 different positions, $100,000 to include our regional clinical advisor. And we're definitely not spending $150,000 on equipment and supplies for Memorial Hospital as the RHCC. So we would, we're open to trying to do the best we can with the funds that's going to be in the best interest of the entire coalition. And while we haven't gone through a full after actions yet, I know a lot of you guys are starting to do that at your agency level, and we will do that as a coalition and how we can better respond next time, not just pandemic wise, but how we can better respond. And that's going to probably lead us to say, okay, what things do we need to buy and what training do we need to incorporate and keep routine? The one thing I will say is that if you come up with an idea, please include a sustainment to whatever that idea is. Everything needs a sustainment tale, how we're going to do it. Like when we talk about these infection control officers, the DICO class, it is, it's great to do that training, but how are we going to maintain it in future years going forward? Who's going to be the point of contact that helps manage that? Keep those things in mind. So, all right. Enough on that.
Phil?
Yes, go ahead.
So, are you looking at, like a COVID quick, rapid task force kind of group. I know nobody wants more meetings, but to not stretch things out over months, but have a session, a couple hours together to, from a big hospital, a health department, a small hospital. And while things are still fresh in everybody's head, and go, you know what, we need 100,000 gowns in the region, so as soon as that supply chain opens, we need to use the money to get that. And we need to rent a climate controlled storage space to put this stuff in. I mean, that kind of thing, because just having people send an idea here or there, I'm not sure you're going to get what you want with this amount of money that needs to be spent.
No, you're right. I agree. I think that's going to come out in the after actions, and what we're going to do to carry forward that may be a task force to actually to run through the nuts and bolts of how we do that going forward. But no, you're spot on. With your analysis there. I think that again, once we identify what we need, then we need to set aside a team of folks to kind of put that into motion. When we try to do this, and again, this is really talking supply side right now. 18 months ago or so, we did we had a regional resources workshop, or whatever we called it. And I don't think we came out with anything conclusive there as far as how we can move forward. I think now we have a lot more awareness of what our shortfalls and limiting factors are, and we can move forward with some of that. We can move forward with some of that with the understanding of what that looks like in a pandemic. But we're going to have to try to make whatever we do going forward something that is sustainable for any type of emergency, not just a pandemic or MCI. We got to make sure that it's sustainable across all those things. So, all right.
Hey, Phil.
Yes.
This is Beth. Just to let you know, the health departments have a 11 o'clock webinar statewide. So I will be dropping off, and I'm assuming that some of them will be dropping off here pretty soon.
Understand. There's a lot of meetings, so I appreciate it. Thank you, Beth.
Uh-huh.
All right, we're going to go ahead and just move forward. We're going to quickly talk KIMPAC exercise future. I think at our last 2 weeks ago, we had Althea join us to kind of give us a briefing on what our options are for our KIMPAC future, and we got a little bit of a mixed bag with responses as far as going forward and executing on the full scale afterwards. After everything is said and done with COVID-19. And the other option was to do it in some form of broken down tabletop / exercise. The majority of the feedback received was to plan for it for a future exercise. So with this next coming year, I don't think we're going to use it with this, with the actual no cost. Well, I don't know if we're going to be able to use it with the no cost extension because we don't know how far this is going to go out. So my plans are to include dollars in this upcoming BP2, budget period 2 grant to finish that exercise and not keep it in the BP1 no cost extension, because just not sure if we're going to still be able to execute it on spring of next year. Don't know if we're going to be there yet. It may be fall of next year that we're executing on it. So that's my plans. Does anyone have any, are there any objections to moving forward in that manner with putting the remaining execution of the exercise, setting dollars aside to execute in BP2 instead of trying to finish it in BP1? We have until I think BP3, maybe BP4 to do a full scale KIMPAC exercise. Any objections? Okay. So that's how we're going to move forward with this upcoming grant that will be included in our work plan again for BP2. Regional plans approval. In our last meeting, everybody received the links and went out. Not sure how many of you guys had the opportunity to fully vet because again we went through the pandemic, but we had we had all our regional plans, the communications plan, the TICP, the regional EOP, the KIMPAC, the strategic plan, etc. I have not received any feedback negative. I did receive a few comments here and there, mostly administrative, but no substantial changes or recommended changes to the plan. I know this is something that we do annually, and I don't think we're ever going to go away from doing it annually. That will always be a requirement of the grant to review and approve annually. Even though CMS guidelines have changed to a biannual requirement for hospitals. That said, we're still going to have to move forward on a review annually. I'd like to know if there's a motion to approve the plans as written with whatever administrative changes that were provided, being that there were no substantive changes submitted during the review timeframe. Does anyone have any objections to that? Or would someone like to make a motion and move forward?
Phil, this is Eric. I think since no one provided any obvious changes, it should be assumed that they should be accepted as written.
Okay, I got there. You said you did have a little bit of it wasn't Kenny G, but it was some hold music. But your recommendation is that if there were no substantive changes, that we accept the plan as written.
That's
is that correct?
correct?
Okay. Anyone else with any feedback with regard to the plans? Okay, then we will move forward with the plans. That also included our section of bylaws. I know, Tina, you will have your official name on there, not just Tina Evans. We will have Legina on there properly this time around. I know I just frequently write Tina enough. I guess that's why I forget to change it. So I will make whatever those last bit of changes this week and send them out and repost them for download. Okay. HVAs. I know you guys have not, some folks have not been in SIMP. Some of you have, but as we talked last time, your HVAs should have been updated. Hopefully, I tried to go in there today to see if I could see a roll up. Greg, I don't know if you're able to, but I do know there's a few that still have not been updated. So I'm just asking that you guys make sure that your HVAs and CPGs within SIMP are updated. There are some that did not carry over, it looks like. From the CPG side of the house, did not carry over to the other side of the HVA and SIMP. So I don't know exactly how or why that happened, but the promise was that information would carry over from the previous year. I don't know if there were some specific changes for some folks, but some of those were blank. So please try to get those updated before the end of next week. I will take a look at it again later this week and then just send out reminders and a list of what's still remaining in SIMP. Does anyone have any questions on the HVAs in SIMP?
Well, this is Tina, and you can put me down. I haven't done anything on home.
I'm sorry, you came in a little bit broken, Tina. Say that one more time.
I forgot to go in and do those, so I'm one of the late.
It's okay. It's okay. There's a lot of things that got forgotten right after our March 4th meeting because that next week everyone was in COVID mode. So it's totally understandable. Totally understandable. I think I looked in today. I saw Memorials was done, but Belleville was done, but Memorial Hospital East was not done. So you're not the only one in that boat, Tina. All right. As far as new business, COVID-19 survey results. So Scott was working. He is currently out, your regional clinical advisor, Scott. He's currently out on the back of an ambulance today getting some ambulance experience. So when we start to have him look at things from EMS perspective, he has a good vantage point from that. But he developed that provider survey that went out. So thank you for everyone that participated in that survey. I think we got back 91 results. So, and I think it's still open. I don't think he closed it, but we're going to start taking those, and he just started filtering this week. So we'll provide those organizations that did receive, that did input feedback on that survey. We're going to start to send that back to the points of contacts at the hospital, so you can share that, so you can review it and share it with your staff. Some of those you'd be quite surprised at the responses, and hopefully, I'm glad they're anonymous in some instances. I'll say that much. Some of them were very pleasant. Some of them were pretty harsh, and that's, I guess, to be expected. There were a lot of stressed out folks during there. EM powered data planning inside, as you guys have seen in our regional EOP, and as required by ASPR, we're to provide updates to the EM power. This is those folks who are dependent on electricity at their home, and we provide those statistics and information within the planning portion of our emergency operations plan. So when you look through there's a bunch of charts, breaks down each county using both that and the social vulnerability index. ASPR requires us to provide updates to this twice annually, and IDPH provides some of that data. Now, they don't provide it to the level of detail that we provided that we broke it down inside of the emergency operations plan. They don't provide it to that level. So my plan is to update that by every 2 years in our plan, but forward whatever IDPH extracts as they extract it to you guys, so you guys can use it. Because I know it took me the better part of almost 7 weeks to pull that information out. I think it doesn't change super rapidly. So I'm going to continue to update that every 2 years or so in our plan, but I will provide whatever IDPH does with their extracts. And I just encourage you guys to be familiar with that data in your local area of if you have a high population of folks maybe that require electricity, and maybe they're dialysis or what have you, that they require electricity, and where that could happen. So if you hear, hey, there's a small blackout in this area, what type of impact that's going to be on the healthcare system. So just wanted to keep you apprised of that. As far as upcoming events, it's COVID right now. Our next COVID meeting is next Wednesday, and when I say meeting, I use that term loosely, but again, it is our Wednesday coalition kind of call, just to kind of talk best practices, things that are going on across the region, what have you, and that's at 1300. IDPH Summit canceled. Decon, we've canceled all classes, and we're trying to look at how we can restart those classes, with class size and maintaining social distancing, et cetera. BJC has a hard cap on participating and organizing any events above 10 folks. We try to only schedule classes that are 10 and above or 10 and above. So if you do have a need that's out there, again, we had, I think, 9 classes on the schedule for the rest of the year. If you have a need, we will work with the organization and try to make sure that you guys are still capable of responding to a hazmat event. So please reach out to me or Lee, and we will work with you guys. If we were scheduled to come out to your organization in this month or next month, please reach out and we'll see what we can do if you still need that type of training. I tend to imagine some folks kind of burnt out and just don't have the time for training, and maybe some organizations again are totally limiting training. We understand, but if there is a need, we'll try to work with you and make sure that happens. We also did, I would say, from the equipment that we did purchase, as you guys recall, we purchased a whole bunch of Avon C50 masks, lots of filters, full face respirators, et cetera, to support decon operations across the region. Some folks still hadn't picked up that equipment and supply, and we gave you guys through December to pick it up. It's still here if some of you still need it, but we have repurposed some of it. Matter of fact, we just got a request from the folks over, I don't know, Lee, you're online. Was that Children's or was it Christian?
It was Christian EMS.
Yeah. You want to talk that just real quick?
So yeah, with all of the protests and everything that's been going on, the folks at Christian EMS kind of got broadsided by this, and since Ferguson is in their venue, they reached out and asked if they could borrow 8 of the Avon masks because of the tear gas that was potentially being deployed and the pepper spray and everything. So we loaned them 8 masks with the understanding that they've got to do their own fit testing, and they'll replace any components, whether it's cartridges, gaskets, whatever. But those masks, that's what they were made for. I mean, that's really what they were intended for. And it sounds like they're actually going to get used for something other than just decon training.
And that's good. So we're protecting providers out in the field, during the course of a pandemic with civil protests going on. So I'm glad we were able to assist. And if you guys find yourself in any of those same positions, please reach out. Other things that are out there on the horizon, the big 2, the International Association of Emergency Managers Conference, 13 to 20 November. They're still trying to plan that and have that executed. I think that's in Long Beach. And then the National Healthcare Coalition Preparedness Conference is in Vegas, and they're looking at 1 to 3 December. All of those are obviously pending, depending on where we're at with the pandemic and the development of a vaccine. We'll see where that kind of leads us. I know there were tons of other things that were canceled. The NACCHO conference earlier this year, in February, or excuse me, in March was canceled. So we're in a holding pattern with a lot of events. That's why this list is so short. All right, guys. We'll open the floor for any comments, questions, concerns, things you see across the region that you'd like to share or need clarification on.
Phil, this is Kelly. 2 things. One, I just got an email from our director of nursing, and she said that our EMS resources has been blocked today from some kind of malware. Are you aware of anything like that?
So you said EM resource was blocked, saying that there was some form of malware on the site. Is that what you're saying?
It just says our EMS resources is being blocked by malware, so we cannot report an update to you today.
I haven't heard of anything, Lee. I don't know. Have you heard of anything?
It almost sounds like it may be on your internal network that it's marking it as malware.
Okay.
Yeah, because I'm in it currently right now. I'm in it currently.
Okay, I'll have her get a hold, or I'll get a hold of our IT department when we're done. And the second thing is, rumor has it on Tuesday the 9th, there's supposed to be some kind of protest up here between our city hall and the CVS pharmacy on the main drag.
Gotcha. Thank you. I know there was someone else about to speak right when you guys were both talking. I don't know if it was Greg, John, Dale.
It was John.
Okay.
I'm kind of back for a minute, sir, but I've got to jump onto another meeting. But anyway, I just would like to say one thing about EM Resource. I am looking at it. It appears to be working okay over here, or at least on my end. But that also leads me into EM Track. I don't know how much that's been talked about, Phil. Did not get the alert or the notification about your weekly meeting for some reason with the Hope Coalition. But
Okay.
anyway, what I'd like to say is that there was a lot of effort put in with EM Track. There was a lot of good information being put in. Some hospitals took it and ran with it to do internal tracking also, which really worked out for them. Yes, it was a separate data that you had to kind of work with, but everybody found out in the long run that tool is a very useful. I think with the ongoing, it's still being used today. I mean, we're up over probably 1,500 PUI patients that were put into the system. I know a lot of the EMS has kind of started tapering off with the data entry, but it's still being put in there. It was a very useful tool. All right, kind of that it is in there. It is being operated, and if your hospital, you know, you might not have it on, or but if you do get a chance, just remember that you do have every hospital has access. Remember, go in there and look. You might see somebody that has been pending arrival for your facility for quite some time. I can tell you, it's not just our little local area here that was using the tracking. It has been used in multiple places throughout our whole region, from the Anderson, Alton, all the way down to, Columbia, down into the Sparta. So just a reminder that that's out there. But other than that, that's all I got. But Phil, if you could, please, sir, I'd love to get in on those weekly little meetings, little huddles, whatever you're calling.
Will do.
Thank you, sir.
Hey,
and also, real
Phil?
quick, I'm sorry. I just wanted to say, because like I said, I haven't been a part of this, the meeting, but I just want to say, this response that we've had to this COVID, yes, we've had a lot of hills to climb and all that, but overall, I have been impressed with many of things. Of course, I've had some worries with a few, but I've had more impressive moments, including Greg Atterbury, Phil, multiple people, and I just hate to name you two, but we got to remember that, guys. This is all about teamwork. Like I said, there were a lot of hills that we had to climb, but I am truly proud to be a part of this region. And I think we did a fair to pretty good job. I think we've learned some lessons. And I think we just need to keep moving forward. We're an excellent team, and we got to keep building to this team. So this team is there when we're gone. So other than that, I'm going to shut up and move on to my next meeting.
Thanks, John.
Hey, Phil.
Yes.
Hey, thanks, John, also. I wanted to say that Dan Lee just sent out an email to everybody regarding issues with EM Resource. It appears that it's a nationwide issue and that they are working on it, but it's a filtering thing. So some hospitals are being affected, some are not. Your IT people should be able to fix it because apparently it moves some people over to that malware listing and they just need to get moved off, but they are working on it. And Kelly, you were on that, so hopefully you have it in your email.
Yeah, I just got the email from Dan myself, and I did take it over that for our IT department.
Wow, thank you. I mean, asking you shall receive. If I would like to get everybody just take a quick look at the slide for today. Some of you received this, some of you may have not received it, but this is kind of where we're at, and I did want to point this out. The you know, as you can kind of see, we went through that big spike early. You know, our peak was early April, looks like. But we have, over the past, since we hit our low for the region at 53 COVID and PUIs, and this is in Region 4, and unfortunately, I don't get a chance to pull Greene County, I think in Jersey, into this one, but this is just across Region 4. We've been steadily increasing over the last week and a half, 2 weeks, as you can kind of see that line going up. So if there's anything to be learned, and you know, we kind of go back and lessons learned, and we look back, and I'm sure all of you've seen it, that 1918 curve did the same thing. Now it was over a larger span because when they implemented all their mitigation measures, they maintained them for much longer than we've maintained ours. Okay, so this phase 3 that we're in now in Illinois didn't occur as rapidly as it occurred back in 1918. That there was a much more prolonged phase of that, obviously due to the level of patients that they had dying from the flu. But if there's any lesson to be learned, and if there's anything that you can do with regard to the folks that work around you and the communication and conversations that you kind of overhear, you know, because I sometimes hear, well, I'm going here, such and such, and I'm just like, do you really want to do that? I find myself interjecting in, and not just to be a Budinsky, somebody who just butts in everybody's information, but it would just be the work that we've done here in Illinois has been great. For having the third largest city in America, I think that we've had a great response overall. Could have been much, much worse. You know, it could have been very much like what we saw in New York. But I think we've done a great job, not just at the coalition level, but at the IDPH level. I will say this: as much crap as I give my IDPH brothers and sisters, I do tip my hat to them on how well they've managed to move through this response. Yes, we've had problems. We've had everywhere there's going to be an issue, but where we could have been and where we are, two totally different things. And I'd hate for us to get too comfortable and get back to a spot where we could be like New York was a month ago. So I ask you guys to remain vigilant, and let's try to keep that curve low. And it starts with you. And if you can be the example in your organization, then it's going to move to the next person, and it's going to move to that person that you visit virtually on Facebook and or your virtual church or wherever you go. Spread the message of, or proselytize the message of mitigation, and that's wearing that mask when you're out in public, hand hygiene, etc. I know I'm preaching to the choir, but it happens to the best of us. Let's not get lazy. Anyone else with anything before we close?
Hey, Phil.
Yes.
I just going to piggyback on your statement there. Just so everybody knows, over the past 7 days, we did have 9,653 new positives in the state. We had 607 additional deaths in the state. And while we are trending down, and that's great news, there are still people getting sick. And I'll also remind you, due to the civil unrest, most of the state testing sites to get tests have been closed for the past 3 or 4 days. So I don't know how some of the private sites have been affected by that, but right at the very moment, we're doing less testing of individuals. So you're right, we can't let our guard down, because we totally don't know for sure where we're at right now in this pandemic.
Thank you, Greg. Dale, I see you unmuted. Go ahead.
Sorry about that. 2 things. One, I think the St. Louis region would like to request a grant from your side. That's a budget we don't see over here. So kudos on y'all for getting it. The second one is just a reminder, the MCI alert and bed query alerts will go out again at 2100 hours tonight. and that will be ongoing through the civil unrest time until further notice. So thank you all for your participation on that very quickly last night and ongoing.
Thank you, Dale. And yes, please ensure your folks have access. I have to go down to our ED because I just heard we got a couple of secretaries that can't access EM resource. So we'll work through that over here. Okay. Last chance. Anyone else?
Hey, this is Danielle from Gateway.
Hey.
While we're talking about EM resource, we were on the call where we had the webinar and really kind of went through the accurate reporting in the system, as well as we would be getting some new user guides. And we did get the user guide from the Siren Alert, but I feel like they mentioned having a recorded version of that training, as well as offering some other little how-to guides, like how to enter data, how to assign rights and the levels of those roles, and then managing alerts. And in the document library in EM resource, there's nothing new there. And I didn't know if I just missed a Siren Alert that would have had that recording and those extra documents. What I have now is just the updated user guide. Trying to get everybody trained up.
No, I totally get it. No, thank you, Danielle, for that. I thought they sent out the recording link. I will go back and look, but outside of that, Greg, can you talk with Dan about the user guide portion of that? I'm trying to look now to see if I have anything additional.
So was that Leanne?
That was Danielle.
Oh, Danielle. So what exactly is she looking for, so I know what you want me to...
I was hoping to get a recording of that training session to share with the end users. And then they had mentioned a couple extra little resources outside of the user guide specific to assigning user roles or entering data and managing alerts.
Yeah, so there was that sent out. I will look for that, and then I will check with him. You're talking about the WebEx they had, was it last week or something like that? Yeah. Okay, I will see if that was recorded anywhere, and I will try to look for there was a Siren, I think, that went out that had that information. I'll look for that, and I will send it on to you.
Okay, thank you so much.
Thanks, Greg. And just courtesy copy of me, and I will send it out as well to just other folks. I appreciate it.
Sure.
Okay. Anyone else? All right. Despite having a 16-minute delay due to phone numbers, we made it done at 11:30. So
hey, Phil.
I'm sorry. Go ahead.
It's Lee. Hey, I may have missed it. I was doing 5 things while we're talking here, but did we discuss the fact we still have supplies on hand? If you need a restock, please let us know.
Lee is like the used car salesman of PPE. He is trying to get rid of it all. Everything must go. So if you need it, we got it right now. And we want to be able to make room, especially if we can get more gowns. If I should have sent you guys pictures or put it in this briefing. Maybe next week I'll throw some pictures up of what the storage area looks like with all the PPE. But if you need it, chances are we have it right now. And we did receive I think, how many, 200 or so reusable gowns as well. So yes. if there was an agency, and it's kind of like I don't know what type of material it is.
It's Cordura nylon.
Yeah, it feels kind of like a rough Gore-Tex / corduroy. But then, I don't know, it's weird, but very reusable.
Phil, this is Tina. And that resource that came out through Siren, it looks like it was on the 28th. It came out, the overview of that webinar and your roles, your rights in a PDF file. And I think there could have been another one after the 28th, but that's when the first one came out.
Thanks, Tina. I'm trying to go back and look now to see if I see it. On the 28th, you said, right? Yep. All right. Anyone else? Once, twice, Thrice. Yep, and I've just found it. Okay, guys. Again, I appreciate everything that you guys are doing out there on the front lines and the rear, helping those who are on the front lines. Please stay safe. If you have any questions or concerns, you can always email myself or Lee, and we will try to get back with you as soon as possible. So all that said, again, a great thank you, and I will talk to you soon. Have a great day.